Have you ever had a head injury and felt like it impacted your voice? You are not alone. Today, I want to talk about cranial strains. When I'm talking about a cranial strain, I'm talking about a part in the cranium or in the head known as the SBS, or the spheno-basilar synchondrosis. At this particular synchondrosis, or this joint, we have normal motion of flexion and extension. When it comes into physiological strains, we could have a right or a left side bend. We could have a right or left torsion. We could have exaggerated extension or exaggerated flexion. And then we have pathological strains where we could have a lateral, right or left lateral strain. We could have a superior, inferior vertical strain, or we can have a compressive strain, a compression. So as you can see, there are a lot of different cranial strains that could happen at the SBS. And you're saying, but Christine, what does this have to do with my voice? Here's a little snippet of a presentation that I gave at the Gathering of Eagles conference last weekend.
That pharyngo-basilar fascia up here connects super close to the SBS. So it can influence our pharynx and what's happening in our pharynx and our resonation.
So not only does the pharyngo-basilar fascia connect up very close to the SBS, but we also have the tongue and a lot of the laryngeal structures hanging off of the styloid process of the temporal bones. So what's happening at the sphenoid bone influencing what's happening at the temporal bones, and guess what? You got it, influencing what's happening at the larynx. In addition to this, we also have, depending on our head positioning and depending on our cranial strain, we also have this hole in the skull known as the jugular foramen. This has really important structures that come down through it, but important of what I'm discussing today, the vagus nerve. The vagus nerve has branches that innervate a lot of these structures: the superior laryngeal nerve, the recurrent laryngeal nerve, the pharyngeal plexus. So a lot of what we're using for voicing influenced by this cranial nerve that, if it's getting compressed in that jugular foramen, can have an impact. So what's happening at the jugular foramen, what's happening at the SBS could influence what's happening with phonation, what's happening with resonance, what's happening with pressure management, what's happening with ease of voicing. So we have all of these things that can impact what's happening around our voice. If you've studied with me before, or if you've been on this platform for a while, you've heard me mention lateralization and occupancy. If those are new terms for you, head over to my website at thevisceralvoice.com and check out our free webinar to help you understand lateralization versus occupancy, because guess what? It happens at the vocal fold level too. What's causing these cranial strains? Well, a lot of things could be causing a cranial strain. We could have birth traumas. We could have physical traumas, whiplash, concussions, so head traumas. We could have braces. We could have Invisalign. We could have rapid palate expansion. We could have a tongue tie. We could have a lip tie. We could have so many different variables that could influence what's happening at the SBS and creating some kind of cranial strain that, yep, you got it, could be influencing the voice. So thank you for joining me to discuss cranial strains. I have a lot of incredible information coming up on the podcast and in newsletters on YouTube, so please be sure to subscribe to those. I want to thank you all so much, and as always, I will continue to learn everything I can about the living, breathing body and its intricate connection to the voice.